Hello and welcome to our oral health care training for health and social care practitioners. This training is provided by the Oral Health Promotion Team at Northern Lincolnshire and Gaul NHS Foundation Trust. This training video is suitable for all those staff groups that work with people who may require some level of support or assistance with their oral hygiene. The training includes dental basics, dental disease and prevention, toothbrushing techniques including brushing for someone else, oral health for older people, those who are medically compromised, denture care and the impact that smoking and alcohol have on our oral health. At the end of this training, we hope to have increased your knowledge of supporting someone with their oral hygiene. Hopefully you will have further understanding of the two main types of dental disease and prevention techniques. You will also understand how alcohol and smoking affects our oral health. There is a lot of information available on the internet, but we recommend that your go-to document should be Delivering Better Oral Health. It's a Department of Health document which includes everything you may need to discuss oral health with your clients. It includes healthy eating advice, motivation techniques and prevention, guidance on improving oral health. We need to ensure that messages are consistent, and therefore this document should be your go-to guide for further information. Another useful tool is NICE Guidance, found at www.nice.org.uk. In particular for this client group is oral health for adults in care homes. The document sets out recommendations aligned with delivering better oral health, provides rationale for why oral hygiene is important, and particularly for those more vulnerable clients that are unable to brush for themselves. The guidance sets out recommendations for policies, care plans, and how they should be implemented in care settings. They stress the importance of good mouth care and how it can impact on a person's general health. Oral health often becomes lower priority when clients are facing other issues. It's vital to think about what needs to be put in place to prevent dental diseases and to ensure a person's oral health is improved or maintained. Adhering to NICE Guidance ensures best practice in every setting or situation. So let's begin by quickly going over some basics. Throughout our lifespan, we get two sets of teeth. The first set are known as our baby teeth, or also primary dentition or our deciduous teeth. As you can see, there's a rough guide on the screen of the eruption dates. In a full set, we have 20 baby teeth. They usually begin to erupt around 6 months of age and begin to exfoliate at around 6 to 7 years old. As they exfoliate, they are replaced with our second set of teeth. These are known as our adult or permanent dentition or secondary teeth. A full set has 32 teeth. The first molar begins to erupt just before we lose our first baby tooth, around the age of 6 to 7 years. The teething process starts from 6 months right up until when the wisdom teeth come through. This can be any age, but this is usually around 17 to 25 years old. It's these adult teeth that we expect to keep for our lifetime. It's a lot more common now that adults are retaining their own teeth, or some of them, into their older ages. Life expectancy is increasing, and therefore we need to understand and know how to care for our teeth and for someone else's. As you can see from the diagram, our teeth are quite complex. You can see here the different types of teeth, from incisors, which are our front teeth, to the molars, which are the back teeth. The structure of the tooth shows the different layers within a tooth and the structures that hold them in place within the jaw. Each tooth has a crown. This is the visual bit that we see in our mouths, and the roots are the part that sits in our jawbone. The crown has an outer layer called enamel. The inner layer is called dentine, and in the centre is the pulp chamber, which houses the nerves and blood supply for each tooth. Periodontal ligaments hold our teeth in place. This support structure is similar to how a trampoline centre is held to its outer edge. The mouth is an indicator of our general health. Poor oral health or an unhealthy mouth can affect a person both physically and mentally. A healthy mouth allows us to enjoy nutritious food, promotes clear speech, promotes confidence and affects our appearance, as well as prevents oral infections or pain that may affect our general health and well-being. Research has found that poor dental hygiene and bleeding gums can allow bacteria to travel through the bloodstream and into the coronary arteries. In those people that have gum disease, bacteria from the mouth can get into the bloodstream. It can affect the heart by sticking to the fatty deposits in the blood vessels of the heart. This can make clots more likely to form. Blood clots can reduce normal blood flow, so that the heart does not get all the nutrients and oxygen it needs. If the blood flow is badly affected, this could lead to a heart attack. People with gum disease are almost twice as likely to have a coronary heart disease as to those without gum disease. This clogging of the arteries can also lead to an increased risk of a stroke. Gum disease has also been linked to a variety of other health problems, such as rheumatoid arthritis, diabetes, and its control. Often, those at high risk of dental disease have certain lifestyle factors that can be indicators or contributing factors as to why they may struggle with keeping good oral hygiene routines, and this can affect a person's general health and well-being. Those at high risk of developing dental diseases are often those who find it difficult to manage their own health needs. This may include those who are medically compromised, people of low socio-economical status, smokers, alcohol users, vulnerable adults. It's important that we consider all the individual lifestyle factors and the external environment of the individual to assess the risks of dental disease and what may have contributed to the cause of their poor oral hygiene in the first instance. We can then begin to address the issues, motivate and support the individual in making the changes or improvements needed. We have started to look at how dental diseases can impact on a person's health, but what are dental diseases? The main ones are tooth decay and periodontal disease. To allow us to look at these in more detail, we first need to understand what happens in the mouth. Millions of bacteria live in our mouth, flourishing on the food that we eat. Some of this bacteria sticks to our teeth and attracts colonies of bacteria onto the tooth surface. You may have felt this on your own teeth. It feels like a fuzzy film and is called plaque. Plaque is a combination of bacteria and food debris on the tooth surface, which forms as a thin, transparent layer. It is soft and sticky, often build-up can be seen and looks creamy white and fluffy. It collects around the necks of the tooth where they meet the gum line. Eating foods high in sugar can accelerate plaque growth. It is the bacteria living in the plaque that turns the sugar that we eat into acid. It is this acid that dissolves the tooth enamel to produce dental caries. Plaque left around the gum line can irritate the gums and can cause gum disease or periodontal problems. If plaque is left on the teeth, it thickens and over a period of time calcifies to form tartar or calculus. This is also known as scale. This hard build-up can only be removed by a dentist using specialist instruments and is the treatment known as a scale and polish. Let's look further into gum disease. When plaque is not removed or brushed away effectively, the build-up of plaque irritates the gum. As you can see here in the top picture, plaque retention around the gum area causes redness, bleeding, swelling, and the mouth can become sore. This early stage of gum disease is called gingivitis. You can see clearly here in the pictures the differences between a healthy mouth and healthy gums and one suffering from gum disease. Healthy gums should be firm, pink in colour rather than red, and they have a stippled appearance similar to the skin of an orange. Healthy gums do not usually bleed. Gingivitis is preventable and is easily treated with a good oral hygiene routine and regular effective toothbrushing. If gingivitis is not treated, it will progress to a more serious gum condition called periodontitis. This is the stage where the supporting structures that hold the teeth in place are damaged. This damage is irreversible. Initially, small pockets form between the teeth and gums, and over time more debris and bacteria collect in this area. Over time, the bone and ligaments and gums are destroyed. Teeth can appear longer as the roots become visible. Teeth become loose and eventually fall out. Dentists can only stabilise conditions. Damage cannot be reversed. This is one of the main reasons we encourage good habits in children to be established from childhood through to adulthood. The pictures here show the stages in more detail that I have just described. Healthy gums are firm, tight, with no bleeding. With gingivitis, the gums are mildly inflamed. There will be bleeding when brushing, and bad breath may be an indicator. Gingivitis, there is no bone loss, no mobility of the teeth, no loss of structures, and no forming of pockets. No gum shrinkage. This is reversible if treated with regular, effective brushing. If routines are not established, then the condition will progress to periodontitis. The gums begin to separate away from the tooth due to the inflammation, and plaque is able to penetrate to the roots and surrounding structures. Advanced periodontal disease will have receded teeth, looking longer, roots will be exposed, and teeth may drift. Supporting structures will be destroyed. The teeth may begin to wobble and eventually will fall out. Bad breath and teeth may be painful and sensitive. The damage done with advanced periodontal diseases is irreversible. Dental intervention is required to help stabilise and prevent further tooth loss. The pictures here further highlight the effects that gum disease can have on the mouth and teeth and help to stress the importance of regular effective toothbrushing. These pictures capture the stages and the effects that gum disease have on the teeth, including the appearance, tooth loss, and how they drift when underlying structures are destroyed. Often this is a gradual process and the effects are not seen initially as the gums cover the damage. It is often not evident until the teeth wobble or the gums recede. The X-rays here show a better picture of the stages that the mouth goes through, from gingivitis through to advanced periodontitis. The second disease we are going to look at is tooth decay, also known as dental caries. This occurs when the acid in our mouth, after we have eaten sugar, eats away at the teeth. It begins by destroying the outer layer, the enamel, the harder surface of our teeth. If left untreated, the decay can progress towards the centre of the tooth until it reaches the pulp chamber. This is what causes toothache, infections, and dental abscesses. Tooth decay is caused when the bacteria in our mouths turn the sugar we eat into acid. For tooth decay to occur, we require teeth, bacteria present in the mouth due to poor oral hygiene, and harmful food behaviours in our diet. This is the consumption of sugary foods and drink. A combination of all these three things create the right environment in our mouth for the process of tooth decay to occur. The tooth decay process is like a constant game of tug-of-war. When we eat sugar, bacteria in the plaque produce the acid. This acid demineralizes the surfaces of our teeth. This is known as an acid attack. The minerals in our saliva, the fluoride in toothpaste, help to keep our teeth strong by remineralizing any damage that occurs, and help the enamel to repair itself by replacing what was lost during the acid attack. Our teeth go through this process constantly. It is a natural process of mineral loss and mineral replacement. Tooth decay occurs when too much sugar is eaten or too much acid is produced to continuously damage the teeth to the point that it disrupts the repair process enough that a hole forms in the enamel. Once there is a break in the enamel, the underlying structure, dentine, is a lot softer than the enamel, and this process can then occur faster. The tooth decay will continue to progress. If habits are not changed and if left untreated, eventually it will reach the pulp. This can cause the pulp to become inflamed, which can then cause a dental abscess. We need to next look at how we can prevent dental diseases. Let's first look at tooth decay. It is the frequency of sugar eaten that needs to change. The more frequent sugar is eaten, the less time the mouth has to remineralize the tooth structures. Therefore, we need to look at diet to ensure that we can keep acid attacks to a minimum. It is often not how much sugar someone is eating that causes tooth decay, but in fact how often someone is having the sugar that causes decay. It's that frequent intake that causes the problem. It can take up to an hour for saliva to neutralize the acid that has been produced. Hence why we need to reduce those acid attacks. We need to encourage snacks and drinks that are low on sugars, or better still to encourage sugar-free alternatives. Drinks in between meals should be water or milk. Tea or coffee is okay, providing it doesn't have sugar added into it. It's also important to know that even though something says no added sugar, it still may have a natural sugar element in it. This description means that no extra sugar has been added. It's really important to look at food labels and the amount of sugar in the foods that are eaten. Often, older people may have a reduced appetite. Sometimes they can't eat large meals and snack or graze throughout the day. They may need extra encouragement to eat well. They are often brought foods and sweets, etc., as gifts and treats, and these should be discouraged to be eaten frequently if the person still has their own teeth, and particularly if they suffer from a dry mouth. Encouragements could be made to bring in healthier snacks and gifts such as fruit, nuts, crackers and cheese. The Eat Well Guide is a very useful resource to ensure that you consider a healthy diet. It provides a visual representation of what consists of a healthy diet. There is also a document to support it which can be found on PHE website. When planning meals, they should be balanced and proportionate to each section on the plate. The guide also reminds us of the importance of staying hydrated. The top corner you can see the water glass recommending 6 to 8 cups of lower fat milk, water or sugar-free drinks a day. Fruit juice does contain sugar, therefore the guide states that this should be limited to 150 ml per day. As you can see throughout the guide, it recommends lower sugar options throughout, and items that may contain high levels of sugar, such as table sauces, cakes and sweets, etc., are not even included in the plate. They should be limited and eaten less often and only in small amounts. Snacks should be selected from the plate, choosing more savoury options regularly, such as fruit and vegetables. The guide also highlights the need to look at food labels and shows the current traffic light system used on packaged foods. The Change for Life programme is a recognised national initiative produced to encourage lifestyle changes to encourage healthier living. One of the initiatives focuses on healthy eating and top tips for teeth. They are really useful resources to encourage and promote messages throughout your setting. There is also an app available that allows you to scan foods whilst in the shops to see the sugar, fat and salt content. One of the advantages of the Change for Life initiatives are they recognise modern life and how we use convenient foods, how small changes can be made that are simple and realistic to improve dental and general health. As well as looking at making diet changes, effective toothbrushing twice a day to remove plaque will also contribute to lowering the risk of tooth decay, as well as improving gum conditions and preventing gum disease. The technique shown in this training will be a manual brush technique. Electric toothbrushes are very effective at removing plaque from the mouth. They either vibrate a sonic brush or rotate or oscillate to provide the circular motion recommended. They should be placed on each tooth. The brush does the majority of the work, they just need positioning in the correct areas. These brushes are also very good for those clients with limited dexterity. Using a fluoride toothpaste is an important element of toothbrushing. The fluoride in the toothpaste is very effective in preventing tooth decay. It is down to personal preference as to whether a manual or electric brush should be used. The important element is that the teeth are brushed thoroughly twice a day for at least 2 minutes. Last thing at night and on one other occasion. A fluoride toothpaste should be used. Fluoride helps to prevent and reduce the risk of tooth decay. Everyone over the age of 3 should use a pea-sized amount. To control gum disease, it's the mechanical action of brushing for effective plaque removal that is important. Some toothpastes contain ingredients that help to reduce plaque, gingivitis and bleeding gums. Mouthwashes should be used at a separate time to toothbrushing, and mouths should not be rinsed out after brushing. We should spit the excess toothpaste out. The fluoride needs to stay on our teeth. Children under 3 can use a fluoride toothpaste of at least 1,000 parts per million. This should be only a smear. Everyone 3 and over should use a pea-sized amount. The toothbrush bristles should be angled at 45 degrees towards where the teeth and gums meet. Starting with the lower teeth, place the brush at the back of the mouth. A circular technique is gentle on the gums and ensures that bristles are working in those areas along the teeth and gum line where plaque collects. Work forward towards the front and then repeat on the other side. Then work in the same method on the inside surfaces of the teeth. This can be easier just by using the tip of the brush. Finally, brush the biting surfaces. Ensure that the brush works along all teeth, particularly at the back. Then repeat exactly the same steps for the top teeth. This time, angling the brush upwards towards the gum line. Again, working methodically to ensure all surfaces are clean. Using a mirror will enable you to see what you are doing. If you are using an electric brush, this will provide the mechanical action. The brush should still be positioned in the same way at a 45-degree angle to the teeth and gums. And then simply move from back to front, remembering to still clean the insides, tops and biting surfaces of the teeth. Any remaining toothpaste left in the mouth should simply be spat out after brushing. Do not rinse. Rinsing the mouth immediately after brushing will wash the fluoride off the teeth, reducing its preventive effect. Remember when brushing to ensure that all teeth and gums are cleaned, be systematic in your approach. The outside surfaces, the inside surfaces and biting surfaces should all be brushed, as well as the gum line on the top and bottom teeth. Sometimes a person is unable to care for their teeth themselves. Often a person may have the capacity but be unable to physically carry out the task, or they may not have the capacity or ability. Whatever the reason may be, encouragement and reminders should still be provided to those that can carry out the task themselves. Those who have a limited dexterity may require further prompts and support to ensure effective plaque removal. There are ways we can adapt brushes to help someone with dexterity issues to remain independent when brushing. For those who may require you to brush on their behalf, shortly a video will explain how better to do this.
I'm Pat and I'm an oral health promoter. We're going to discuss oral care for people with disabilities. If their dexterity is compromised, we may need to look at adapting toothbrushing techniques and/or adapting toothbrushes to help people remain independent when toothbrushing.
There are lots of ways in which we can adapt toothbrushes to help someone remain independent with mouth care. Electric toothbrushes have large handles, making them easier to grip, and they carry out the mechanical action of brushing, which is helpful for those with limited arm strength and dexterity problems. There are also specialist manual brushes available with multiple heads that clean all tooth surfaces at once. They are great for when opportunity is limited, such as cooperation issues or difficulties in keeping the mouth open for long periods. Normal brushes can be adapted with a cloth and bands, pipe lagging, or handle grips to allow a person to hold the brush more easily. Brush handles can also be heated and then bent to adjust the position of the head. Mouth props and finger guards are good to allow someone to bite on when they can't keep their mouth open for long periods. They're also great to prevent you from getting bitten. It's down to personal preference as to whether a manual or electric brush should be used. The important element is that teeth are brushed thoroughly twice a day for at least 2 minutes, in the morning and last thing at night. A fluoride toothpaste should be used. Fluoride helps to prevent and reduce the risks of tooth decay. Everyone over the age of 3 should use a pea-sized amount. To control gum disease, it is the mechanical action of brushing for effective plaque removal that is important. Some toothpastes contain ingredients that help to reduce plaque, gingivitis and bleeding gums. Mouthwashes should be used at a separate time to toothbrushing, and mouths should not be rinsed after brushing. We should spit the excess toothpaste out as the fluoride needs to stay on the teeth. It's really important when giving mouth care to someone else that we think about communication. Often staff can find it quite difficult to brush someone else's teeth. It's really important to explain throughout what you are doing and make the person feel comfortable. We need to consider all aspects of communication, not just the verbal. Think about your tone of voice, the posture and gestures that you make, your facial expressions, and body language. Use simple language, avoid jargon or medical terminology, short, appropriate sentences. The communication should be two-way, encourage responses and communication. Ask questions and feedback, ensure understanding, and use active listening skills. All forms of communication are valuable. It helps to put a person at ease and can build relationships, and good rapport with the person can help make difficult tasks easier. Tracy and Pat, our oral health promoters, will now demonstrate how to brush someone else's teeth.
Hi Tracy, I'm Pat and I'm here this afternoon and we're going to do some toothbrushing, is that okay? Okay, what I'm going to ask you to do is just rest your head on me and ask you to open wide. And when you've got the head resting on you, it's very easy to give you, it's much better, it gives you better vision and better access to the mouth. Okay, are we all right there? What I'm going to do now, I'm going to put some toothpaste on. We're going to use a pea-size amount. Are you feeling okay, Tracy? Keep your head resting on me, and I'm going to ask you to open wide, and we're going to start by brushing the teeth at the bottom. I'm going to start by brushing these teeth that we chew our food with the biting surfaces. Gives them a really good scrub. Once we've done that, we're going to angle our brush and we're going to brush round and round and round in circles, working from one side all the way round, and starting and doing the other side, brushing the gums as well as the teeth. This is a better way of removing any plaque and food that I may have got caught in the teeth and around the gums. I'm going to turn our brush long ways. I'm going to brush in the inside where our tongue goes, and again brushing the inside of our teeth and gums, brushing round and round in circles. Okay, all right. Am I okay to continue?
That's fine.
Okay, then I'm going to start on the top teeth. We'll start again by brushing these teeth on the biting surfaces, the teeth that we chew our food with. Okay, giving them a good scrub. Lots of little nooks and crannies where the plaque can grow. I'm going to turn our brush angled again and brush round and round in circles, swapping the toothbrush over and brushing round from one side to the other. Okay, then we need to open wide again. Turn our brush long ways and brush on the inside of our teeth, behind the front teeth. And then angle our toothbrush again, brush round and round in circles on the inside of the teeth, and then the other side. Okay, and then we will ask Tracy if she can spit.
Ensure the person is sitting comfortably in a back-supported chair. We need to stand to the side or behind them. Remove any dentures first. These should be cleaned separately. Support the head and gently pull back the lips to insert the brush. A small brush should be used and a pea-sized amount of fluoride toothpaste. Take care to brush all the teeth as shown in the demonstration. Be careful around any loose teeth, but they still should be cleaned. All teeth should be cleaned ideally twice a day. If a person tires easily, do one side and then the remainder later. You can use props and mouth guards to help keep the mouth open, and if possibly, try to clean interdentally once a day. Interdental cleaning is the process of cleaning in between the teeth. This is usually done with dental floss or interdental brushes. We also need to consider communication when providing mouth care for someone else. It may be that the person can brush their own teeth but just need the prompts or reminders for them to do it twice a day. Often, mouth care can be a difficult staff for task and clients. Mouth care and teeth for some reason can be quite an invasive task. Dental phobia is also common. However, your own feelings towards dentistry and teeth should not impact on the care that you are providing for someone else. If you have issues, you need to discuss this with your manager, as you may require additional support or training to overcome any boundaries towards personal care for someone else. It is very important to always explain what you plan on doing and obtain consent throughout the usual communication methods. Depending on the client, this may not be verbal. You need to make sure the person feels at ease and comfortable. Think about your non-verbal communication, your body language, facial expressions, and use simple terms and appropriate language. If communication is non-verbal, prepare pictures or storyboards to explain the procedure for toothbrushing. The conversation process should be two-way, and this will assist you in making the task as comfortable as possible for both you and your client. Building a good rapport and relationship will help to make tasks that may be difficult easier. I have already mentioned how brushes and handles can be adapted. The Dr. Bauman's brush can be a great alternative when windows of opportunity is limited, or when someone is not able to cope with toothbrushing for very long. The video provides a demonstration on how this brush should be used. This video will demonstrate how a double-headed Dr. Bauman's brush should be used. The brush should be placed at the back of the mouth, starting on the last tooth. Let's start with the top teeth. As you can see, the brush is designed to clean all surfaces of the tooth and gum line at once. It works the same on all teeth. Slight pressure may be needed to ensure the brush reaches the gum line. The brushes also come in different sizes. Choose the most appropriate size. The brush should be moved back and forth, ensuring it works over all the teeth, bringing it forward towards the front of the mouth. Once at the front, take it to the other side and repeat on the other side, bringing it forward again to the front of the mouth. This should then be repeated on the lower teeth. It is becoming increasingly common for older people to have their own teeth. There could be other associated factors to consider as to why a person struggled to maintain good oral hygiene. It could be that a person had good oral hygiene in the past, and this has now declined in quality over time and causes concern. Barriers to good oral health can include things such as the death of a spouse, changes in motivation such as cooking for one, the reduced physical activity or mobility, failing health or eyesight, illness, dry mouth, deterioration of taste and smell, loss of appetite, a physical disability, poverty, discomfort from ill-fitting dentures, lack of information on health and nutrition, receiving high volumes of confectionery as gifts, and other old habits such as sugar in tea. If someone simply lacks motivation, it may be that they just require more frequent prompts to care for their own oral health and brush their teeth. And as discussed earlier in the training, we also need to consider the individual lifestyle and environmental factors as to why someone may have poor oral hygiene. Another client area where we need to be vigilant about someone's oral health is those individuals who have swallowing difficulties or who are nil by mouth. Mouth care for these clients is still important, as a neglected mouth causes bad breath, discomfort, and plaque will still be present and contains bacteria that can cause chest infections. Brushing also stimulates the mouth and reduces hypersensitivity. Dental erosion is more common due to the reduction in saliva and reflux. A small soft brush should be used if hypersensitivity is present, until proper brushing can commence. Suction should be used whilst cleaning before and after if available. When brushing, the person should be upright if possible with their head tilted forward. If this is not possible, aim to lay them on their side with their head on a pillow covered with a towel. If seriously ill, they should be laid on their side. Use a small pea-sized amount of low foaming toothpaste and no water. An aspiration toothbrush can be used if available. These attach to the suction units. Pink sponges are not recommended as they are ineffective in the removal of plaque and pose a choking risk. Wipe any excess from the mouth with a towel. For those patients who have difficulty or pain in swallowing due to a stroke or dysphagia, they will most likely have poor oral hygiene. Unremoved food and liquid may enter the lungs, and this may cause harmful bacteria to grow. A serious infection can result. This is known as aspiration pneumonia. It is paramount that the oral health of these patients is addressed. They are more vulnerable in hospital. Information should be given to carers if they leave hospital and go into a residential setting. Toothpaste that do not foam are particularly useful for people with difficulty swallowing and those that are nil by mouth. Even some adults and children with learning difficulties struggle with excess saliva or dry mouth and find it difficult to use regular toothpastes. The main foaming ingredients found in toothpaste are sodium lauryl sulfate or sodium methylcocoyl taurate. The main brands on the market for non-foaming toothpastes are Sensodyne Pro Enamel, Oral-Nurse, Bio Extra and Biotine. There will be other brands available, it's just making sure that they are non-foaming or low-foaming toothpastes. Oral-Nurse is a particularly good toothpaste for the conditions mentioned here on this slide. It is also an unflavoured toothpaste, so it's very good for those individuals that don't like mint or find it difficult because of sensory problems to deal with the foaming or the flavours in toothpastes. Other common oral health problems in older people include xerostomia, which is a dry mouth, denture stomatis, which is a fungal infection of the soft tissues. Angular colitis are cracks at the edge of the mouth caused by fungal or bacteria. The small reddened cracks are reoccurring and do not heal. Often there will be dry lips and a burning sensation as well. Thrush is also another common problem in older people, particularly those that wear the dentures for long periods or don't remove them at night. As we get older, we are more prone to gum recession around the gum line. This can expose the dentine, which is then more prone to dental caries. This is also known as root caries. This can cause sensitivity due to the recession of the gums and the exposed dentine. Oral cancers are also more prevalent in older people. The risks are higher for those who smoke and consume alcohol. Those individuals who are medically compromised are often more at risk of oral health problems, and some systemic diseases have oral health complications. Diabetes can cause gum problems due to the blood vessel degeneration and altered collagen metabolism affecting repair and maintenance of body tissues and difficulty fighting infection. Epilepsy can cause gingivitis or a gingival overgrowth associated with anticonvulsant drugs. With AIDS, you may often see gingivitis is more severe with ulceration, thrush and herpes simplex virus. Rheumatoid arthritis can cause jaw problems, pain and difficulty in opening the mouth. If the hands are affected, this can also cause difficulties with cleaning your own teeth. Crohn's disease and colitis sometimes present with oral manifestations. Patients can have gingivitis and severe ulceration despite good oral hygiene. Lichen planus is a systemic skin condition that can also affect the mouth. It often presents with white patches on the tongue and soft tissues. There are many different reasons for a dry mouth. Here are just a few examples. It can often be due to a side effect of medications or even stress and anxiety. Autoimmune or systemic conditions, as we've already mentioned, as well as those who are undergoing or have received cancer treatments such as chemotherapy or radiotherapy. There are a few things that we can suggest to clients to help with dealing with the dry mouth. Having a diet of high fruit and vegetables can stimulate saliva flow. Foods high in sugar should be avoided. Chewing sugar-free gum can help stimulate saliva. Older people may not want to do this, and it can sometimes be difficult when wearing dentures. Drinks of water should be offered frequently for sipping. Sucking on ice chips, and lubricating the mouth with olive oils or sesame seed oils. There are saliva substitute products available and also prescription drugs that stimulate saliva flow. Teeth should be brushed twice a day with a mild non-foaming toothpaste that contains fluoride. Mouthwashes can be used. They should be alcohol-free. You can get ones that are specialist varieties, particularly for people suffering with dry mouths. This should be done either after brushing or at any time during the day after meals to remove food particles retained in the mouth. Biotin gels or sprays for rapid moisturising can provide extra comfort during the day and used as often as required. They can be applied under dentures to make them more comfortable to wear, and also applied before bedtime for long-lasting lubrication and comfort. Next, we will look at how to care for dentures. Dentures should be treated like normal teeth, but cleaned out of the mouth twice a day and after meals if necessary. The steps are shown here on this slide, but now a short video will be played by Tracy, our oral health promoter, on how to clean a denture.
This is a simple demonstration on how to keep a denture clean. Just like natural teeth, dentures harbour bits of food and deposits of dental plaque. Firstly, it's important to clean the dentures over a sink or a bowl of cold water. This prevents breakage if a denture is accidentally dropped. Make sure all the surfaces are cleaned. The same applies to chrome or metal dentures. Ideally, they should be brushed at least twice a day. Once you have finished brushing, rinse them under cold water. When dentures are not being worn, they should be kept in a small container and submerged in water. This will prevent shrinkage. I am using liquid soap rather than toothpaste, which can scratch the acrylic of the denture. If you are using a denture brush, use the smaller side. This will help enable better access and will clean the intricate areas. Again, clean all the areas as I did with the top set. I am treating these teeth exactly as I would my own natural teeth. Again, give them a rinse and pop them into a container. If preferable, dentures can be soaked in shop-bought solutions. Ideally, dentures should be left out of the mouth for at least 6 hours in every 24.
We need to consider other dental problems as well. The first one is erosion. This is the loss of tooth enamel. It usually shows up as hollows in the teeth, and when enamel is worn away, it exposes the dentine. This is a yellowish colour, and every time you eat or drink anything acidic, the enamel becomes softer for a short while and is prone to be worn away. Anyone who drinks excessive amounts of fizzy drinks or fruit juices is at high risk of developing tooth erosion. These drinks have high acidity that can dissolve the tooth enamel. Drinking milk and water reduces the risk of tooth erosion. Acidic drinks should be drunk quickly or through a straw, and then wait for at least an hour before brushing teeth. Chewing sugar-free gum after a meal can produce more saliva and help neutralise the acids. The acidity in fizzy drinks is also there for diet drinks as well as those that are not diet. It is not the sugar content that is causing the problem, it is the high pH level of the drink. Tooth erosion can also be seen in people with eating disorders such as bulimia. They often suffer from tooth erosion as the frequent vomiting causes tooth damage from the stomach acids. This is often seen on the inside surface of their teeth. Another concern is abrasion. This is the loss of enamel due to the mechanical factors such as destructive toothbrushing techniques, pipe smoking, piercings around the mouth or in the tongue, people who constantly hold foreign objects in their mouth such as pens or hairpins. Attrition is wear on the tooth biting surfaces. It is usually caused by grinding or clenching our teeth. In the final sections of this training, we will first look at smoking and alcohol and the risks that they have on our oral health. People who smoke are more likely to have gum disease. Smoking may change the type of bacteria in dental plaque, increasing the number of bacteria that are more harmful in our mouths. It also reduces the blood flow in the gums and supporting tissues of the tooth, and makes them more likely to become inflamed. Smokers' gum disease will get worse more quickly than in people who do not smoke, because of the reduced blood flow. Smokers may not get the warning symptoms of bleeding gums such as those that non-smokers get. Smoking isn't just bad for our lungs and our heart, it's bad for our teeth and gums and dental health too. It causes yellow or brown staining on the teeth, bad breath, gum disease, and also loss of teeth. Many people know that smoking causes lung cancer, but not many people still realise it can cause mouth cancer too. E-cigarettes are thought to be less harmful than tobacco cigarettes. They are increasingly being used by smokers and ex-smokers to reduce the amount of tobacco they smoke. The long-term safety has not yet been established. Smokeless tobacco, for example chewing pan, is just as harmful as smoking regular cigarettes, if not more so, and has been implicated in the risks of oral cancers. This slide gives a brief overview of the benefits of quitting smoking. We can also encourage patients to quit by using the 3 A's of ask, advise and act. And the best way of assessing somebody's motivation to stop smoking or chewing tobacco is simply to ask, do you want to stop? Please take a few moments to read the timeline. Many of us like to have a little glass of something to wind down in an evening after a long day, and it's very easy for one glass to turn into 2, and the amount of alcohol that we drink can easily sneak upon us. The trouble is that it sneaks upon our body also. By drinking over the recommended daily amount regularly can lead to serious health problems, from liver damage to greater risks of cancer or heart attacks. It can also cause dental erosion and tooth decay. Alcohol contains lots of calories and also sugar. Current government guidelines around alcohol is that you shouldn't regularly drink more than 14 units a week. Keeping within these recommended guidelines lowers the risk of causing harm in most circumstances. Cutting back on alcohol can also help our general well-being. Some of the benefits are feeling better in the morning, having more energy and feeling less tired during the day, better skin condition. On top of this, too much alcohol can really pile on the pounds. Drinking 10 pints a week could be more than 120,000 calories a year. Also, regular drinking can benefit the immune system. Heavy drinkers have more problems with infectious diseases. Cutting down on the amount we drink will enable the body to fight off bugs more easily, which can contribute to better oral health and general health. By regularly drinking over the lower risk guidelines increases the chances of suffering more serious health harms such as cancer of the throat or esophagus or larynx. Regularly drinking 2 large glasses of wine or 2 pints of strong lager a day can make you 3 times as likely to get mouth cancer. The more you drink and the more often, the greater the risk is for your general health. And for people with medical conditions such as diabetes or high blood pressure, or suffering from depression, anxiety, alcohol often makes life worse. Mouth cancer, or also known as oral cancers, is where a tumour develops on the surface of the tongue's mouth, lips or gums. Tumours can also develop in the salivary glands, tonsils and pharynx. The most common symptoms of mouth cancer include red or white patches in the mouth or throat, a lump or an ulcer. Other symptoms may be persistent pain in the mouth, pain or difficulty when swallowing, changes in the voice or speech problems, swollen lymph nodes in the neck, unexplained weight loss, bleeding or numbness in the mouth, a tooth or various teeth that become loose for no obvious reason, and difficulty moving the jaw. Many of the symptoms listed above can be caused by less serious conditions, such as minor infections, but it's strongly recommended to see a GP if any of the symptoms listed last for more than 3 weeks. It's especially important to seek medical advice if people are heavy drinkers or smokers. The 2 leading causes of mouth cancer in the UK are drinking too much alcohol and smoking. Both are carcinogenic, which means they contain chemicals that can damage the DNA in cells and lead to cancer. The risk of mouth cancer increases significantly in somebody who is both a heavy smoker and a heavy drinker. Exactly what triggers the changes in DNA that lead to mouth cancer and why only a small number of people develop mouth cancer is still uncertain. There are 2 ways in which mouth cancer can spread. Directly, the cancer can spread out of the mouth into nearby tissues such as the surrounding skin or into the back of the jaw. The second is via the lymphatic system. The lymphatic system is a series of glands found throughout our body, which produce many specialised cells needed by the immune system to fight infections. Other risk factors include chewing tobacco or smokeless tobacco products, chewing betel nuts with or without tobacco, having a poor diet, the HPV virus, and poor oral hygiene. Mouth cancer can occur in any part of the mouth, tongue, lips, throat, salivary glands, pharynx, larynx, sinus, or any other sites located in the head and neck area. These mouth cancers have a higher proportion of deaths per number of cases than breast cancer, cervical cancer, and skin melanomas. It's really important that we encourage people to do self-examinations and that care staff do know what to look out for. So around the head and neck area, look at your face and neck in the mirror. Normally the left and right sides of the face should have the same shape. Look out for any lumps and bumps or swellings on either side of the face. Press along the sides or front of the neck to feel any tenderness or lumps. In the lips, we should be looking inside the lips and feel the tissue surfaces around the lips for any lumps. So use your thumb and forefinger to pull the cheeks away from your mouth and look for any red, white or dark patches. And gently squeeze around and roll both cheeks between your fingers to check for any lumps in the area or tenderness. On the roof of the mouth, tilt the head back and open your mouth as wide as you can to see if there are any lumps or if the colour is different or unusual. And then run your finger along the roof of your mouth to see if there's any lumps or bumps or unusual areas. With the tongue, you can stick it out and look at the top surface and the texture, and then pull the tongue from one side to the other, look for any swellings or colour changes, and then examine underneath the tongue by putting the tongue tip to the roof of your mouth. The floor of the mouth, We want to be looking on the underside for any colour changes that are different from what's normal. Gently press your finger along the underside of your tongue to feel for any lumps, bumps and swellings. And then on our face we need to just examine to see if we see any changes in skin colour or any moles, sores or growths. Finally, it's really important that the client group does still visit a dentist regularly. They should still have a checkup at least every 6 months, but the dentist will often recommend that frequency depending upon whether they're high risk to dental diseases or not. Those patients or client group that do have difficulty accessing general dental services may be eligible to be seen by the community dental service. This is a service that is referral only. They do operate from community clinics, but there are home visits available. It depends on criteria and whether your client would meet the criteria for the service. Referrals can be made via GP, via residential homes, via care staff, and the information can be found on our local hospital website. Those people that do wear full dentures should also see a dentist regularly. This concludes our training for those professionals that work with adults and support those that may require additional support with their health needs. I do hope it has increased your knowledge of dental diseases and the prevention and provided you with ways in which you can assist your client group with their oral health needs.